Hi everyone, my name is Kara and today I'm going to be presenting on mental illnesses. So what is a mental illness? It is a disorder that can affect mood, thinking, and behavior. It can affect an individual's ability to function in everyday life. It can affect someone at school, in their workforce, or relationships. There are many different types of mental illnesses, and they all share some similar characteristics and also share different characteristics. Some quick facts. There are various disorders that are classified as a mental illness. There's not just one. It is the leading cause of disability in our country. 1 in 5 adults have experienced a mental illness in the last year, and depression, which is a common mental illness, affects roughly about 9.5% of the US adult population. The causes of mental illnesses. Life situations, anything that can put your body under stress, such as a death in the family, having financial problems, going through divorce, or maybe even a college student. Medical conditions such as disease or serious injuries that put the body under stress, and any traumatic experience, such as someone coming back from overseas and who is in the military. You can also inherit traits that can cause a mental illness. So someone who has a blood relative that um, has a mental illness is more likely to have one as well. There are also specific genes that are passed down or inherited. Um, Next, there are environmental stressors before birth. So the mother carrying the child may go under any kind of stress that puts the baby at risk. She could be having inflammatory problems. She could have toxins in her body, such as alcohol and drugs. And lastly, one of the most important ones is the brain chemistry. As we know, there are neurotransmitters that naturally occur in our body, and they're stimulated in the brain, and they can become impaired. And also, nerve receptors can become impaired as well. Now, I listed a lot of mental illnesses, but today we are only going to be focusing on depression. But some of the most common ones are bipolar disorder, depressive disorder, anxiety disorder, OCD, feeding and eating disorders, personality disorders, and those are just a few that I named, but this whole list is a lot of mental illnesses that can affect someone. So, the signs and symptoms of a mental illness are withdrawal, dropping in functioning, which is just a decline in schoolwork or just social activities in general, problems thinking, you're losing your concentration, um, increased sensitivity, so maybe all your senses are very irritated easily or they're not working at all, apathy, feeling disconnected from yourself. Like most patients would say, I'm not feeling myself, feeling like myself. Illogical thinking, very extreme nervousness, unusual behavior, not acting like yourself, very irrational behavior, sleep and appetite changes, and lastly, overall mood changes. And please note that one or two of these signs and symptoms will not determine if you have a mental illness, but when you have many that occur at the same time is when you want to be concerned and maybe consult a doctor. So diagnosing a mental illness, you first want to have a physical exam because it can rule out other problems, physical problems that may have the same symptoms as a mental illness. You might want to have a lab test done just to check for thyroid function and screen for alcohol and drug abuse. Psychological evaluations, where you may be evaluating your symptoms, how you're feeling, why you're feeling it. You may be asked questions, and you may be giving some questionnaires to fill out. And when determining which disorder you have, it's very difficult because a lot of them have very similar signs and symptoms. So it may be difficult for a doctor to diagnose you with a specific one. Now, a new type of diagnosing is neuroimaging scans. It can't alone detect a mental disorder, but it does help rule out other illnesses or diseases. It can also diagnose like how your brain works in certain situations. Sorry about that. So management and medications. For most disorders, there's usually a combination of treatments that works the best. At first, when you're diagnosed, you'll be given a team made up of many different doctors. Um, Now, the first type of management would be medication. And please note that medication does not cure mental illness, but it does alleviate some symptoms and improves the individual's daily living. So, the first type of medication is antidepressants. They improve symptoms of sadness, hopelessness, lack of energy, and concentration. Anti-anxiety reduces general anxiety, agitation, and insomnia. Mood stabilizing. They treat bipolar disorders by alternating the episodes of mania and depression, and they're also used with antidepressants. And then there's antipsychotic, which is used to treat psychotic disorders, and again, it's usually used with antidepressants. Another type of management is psychotherapy, which is just a talk therapy where individuals talk about their condition and what they're feeling, and they ask maybe why they're feeling it. They may become educated more about their disorder, so this allows them to cope with what they're going through. Also, there's brain stimulation. It's usually the last treatment if other treatments aren't working effectively, and it's usually used with depression. Also, for severe mental illnesses, you may be hospitalized in a psychiatric hospital. And just some lifestyle and home remedies. It's just sticking to the treatment plan you were given by your physicians, avoiding drugs and alcohol to make any symptoms worse, staying active, always being involved in exercise, even if it's very little, minimum exercise, and just creating and maintaining a positive outlook on life, even though that may be hard for some mental disorders. Now we're going to get into the effect of mental illness on the exercise response. So when you're exercising, your body releases feel-good hormones, or not hormones, chemicals that can ease symptoms of depression. The chemicals that are released include neurotransmitters and endorphins. So endorphins increase natural immunity and reduce the feeling of pain, while neurotransmitters directly improve mood. So being involved in regular physical activity can improve mental health. It improves the quality of life and emotional well-being of anyone. It can be used as a coping mechanism. It can reduce social isolation. It may help a person gain confidence, and also allows the person to take their mind off things. Now, I found 3 studies, and the first study I found explained the effects of exercise on an individual suffering from depression. It stated that they participate in moderate intensity exercise for it stated that moderate intensity exercise is beneficial and can increase mood. So the study was published in the Journal of the U.S. National Library of Medicine. It was done with 30 moderate depressed men and women. They were randomly selected to participate in an exercise intervention group, a social support group, and just a control group. Now, the exercise intervention group walked for 20 to 40 minutes 3 times a week for a total of 6 weeks. And it was concluded that the exercise program did alleviate overall symptoms of depression and was more effective than the other groups. The next study I found was again published in the U.S. National Library of Medicine. It had participants exercise on a cycle ergometer instead of walking. 4 times a week for 30 minutes per session for a total of 6 weeks. The aerobic exercise was compared to an attention placebo effect, which was having patients listen to a white noise type of sound. And the results showed again that the aerobic training showed a clear reduction in depression symptoms compared to the control group. And then these improvements were kept for 3 months post-intervention. The last study I came across was conducted to show the difference between aerobic and non-aerobic exercise. It was again published in the U.S. National Library of Medicine and was comparing running and weightlifting and its effects on depression. So there were 40 depressed women who participated in this study and were randomly assigned to running, weightlifting, or just a simple control group. Each participant completed 4 training sessions a week for a total of 8 weeks. And the depression symptoms were evaluated mid-intervention and then post-treatment for the first, 7th, and 12th month to follow. Again, the results showed that both types of exercise reduced symptoms of depression. It did show a very, very slight increase of in weightlifting than running, but overall they were very similar in alleviating depression symptoms, and the control group was nowhere near running or weightlifting. Now, my case study that I came up with was a 17-year-old female. She was obese, she is a smoker, sedentary, had high LDL and triglyceride levels, but did have good, healthy HDL levels. She was on medication, sertraline, which is an antidepressant. Because she had an attempt of suicide, that's why her physician prescribed her antidepressants to manage her symptoms. And her goal was to have a more positive outlook on life and be able to feel good about herself. Now, I put her under moderate risk because she has a total of 3 positive risk factors and is asymptomatic. So when working with someone with depression or any mental illness, you must be aware of the symptoms, first off. You want to find activities that are safe for the individual, depending on where they're at in their treatment. And also, you want to make sure the individual is allowed to participate in the exercise, meaning if they're stable enough or they did get cleared by a physician. I prescribed her gross motor activities such as walking, slow jogging, biking, using elliptical, or doing water aerobics if they were available. I said 3 to 5 times a week at low to moderate intensity, 60 to 70% of heart rate reserve, for 40 to 60 minutes per session. But in some of the studies I found, as little as 10 to 15 minutes at a time can make a difference. You don't have to do the exercise all at once. So in conclusion, after doing all this research, I found that it is important to realize that not every diagnosis will be the same for all the mental illnesses. So we as healthcare professionals should be cautious when working with someone with a mental disorder. We want to make sure that everyone is aware that you can benefit from exercise. Exercise can relieve symptoms of mental illnesses, which can overall improve the individual's everyday living and overall quality of life. And the most important thing is always be positive. Now, here are all my references for my presentation. I hope you guys have a great day, and thank you.